What's going on, folks? It's your boy again, Dr. Sean Thomas, back in the building. Be More Today Show, episode number 92. We are back in the building. And folks, it is springtime. You already know we are in the season of spring, the best time of the year, I think. But a great time for us to be alive and for us to continue to keep the Be More Today Show going. As you all know, the Be More Today Show is cruising, continuing to grow every single week. Right now, we're heard in 56 countries, over 17,000 downloads. So thank you so much for your love and support. It does not go unnoticed, I promise you. It's been a labor of love, but so much fun connecting with so many people who are doing extraordinary things around the world in the world of health and fitness. So as you already know, BeMoreToday.com has my book. Our swag store is open for all your swag stuff for the springtime season. And the podcast, again, you can always click on there and continue to follow the progression of the Be More Today show as we continue to move and groove through this life. Our quote for today is simple as always. It is given to us by Judge Katani Brown Jackson. And she said simply, I would tell them to persevere, period. This is a time where we are recognizing that there are wars happening around the world. There are physical challenges happening. COVID-19 is calming down, but still kind of here. We as people are continuing just to be able to persevere. And I just want to encourage everyone listening today that no matter what the problems may be, the challenges in terms of your health and wellness, in terms of your physical issues, or even in terms of your personal things, right? We are focused and dedicated to make sure that we can persevere. We're going to hit challenges. We're going to hit roadblocks in life. We're going to see things that are going to knock us off of our regular path. But I do think the whole point of the Be More Today show is to encourage people just to keep pushing. And that every day is a blessing, every day is a gift. No matter what's happening around us, no matter the challenges that we face every single day, we're still here. And we're able to actually wake up and appreciate this life that we have because we only get one chance to get it right. So I charge you to go out there and to make today special, to make today more, and to persevere through whatever you're going through, whether it's personal stuff or physical stuff, whatever it is, just to keep pushing. And I brought someone on the show today who sees people persevere every single day in various ways. He's a great friend of mine, an old school friend of mine from, you already know, Brown University. Bruno, you know, I always call it the best school in the world, clearly. But he is my good friend, Dr. Stanley Voigt. Now, Dr. Stanley Voigt is a graduate of Brown University, Bruno, you know, and Brown University Medical School. He then went on to complete a residency in Otolaryngology at Tufts Medical Center in Boston. Dr. Voigt joined associates in otolaryngology in Alexandria, Virginia in the summer of 2015. And his wife, Elizabeth, is a veterinary surgeon, and they have 3 young girls. He specializes in healthcare problems affecting the ears, nose, and throat, and sinuses for both adults and children. Dr. Voigt also has a special interest in sinus disorders and laryngology. Now, Dr. Voigt was included in the Washingtonian Top Doctor Class of 2020 and the Northern Virginia Magazine Top Doctor Class of 2022. In his spare time, he enjoys dancing, watching basketball, and spending time with his family. Ladies and gentlemen, boys and girls, pets included, please welcome to the stage my guy and the man with the master plan, Dr. Stanley Voigt. Dr. Voigt, what's going on?
Not much. Thank you for inviting me.
Listen, I had to have you on the show. You already know you're one of my good friends from school, and I've had the blessing really of watching your progression. I was 2 years older than you at Brown University, but I, through your friend and your brother Cliff, clearly, who is a great friend of mine, got a chance to really know you on a personal level. And from watching you dance salsa and mezcla to doing so many other things in your life, you really just become a beacon of light, not just where you are in your neighborhood now, but just in general. I've really just seen the progression of you and your family, and you being a father, and you just being a prominent Black man in various communities. I'm proud of you. I'm proud of what you're doing. I'm proud of your growth and your progression. And I just love seeing the things that you're doing. Wherever you go, you can just continue to bring out things, whether you're in Virginia or DC, you're just bringing our education to others and just helping your community. So I had to have you on the show this week to make sure that everyone knows how great you are and for you to bring some light to the ENT world for us. So thank you for joining us today.
Well, thanks for inviting me, Sean. I appreciate it. it goes both ways. Going to Brown, you were a mentor to both me and Cliff. And this is the least I can do just because, you have been spreading such positive energy, just like you did at Brown. Sean was definitely a big, big mentor. I just remember coming to campus and just seeing the way you carried yourself and wanting to model myself, and Cliff the same way. So, we continue to keep in touch, and, I jumped on this opportunity to support, Be More Today, because it's such a great cause. And like I said, I appreciate what you do.
Awesome. Thanks, Doc. Let's get into it. Listen, we've had a number of MDs on the show talk about their specialties. And as a physical therapist, I deal with a lot of various issues. But when it comes to ENT issues, I don't know a lot. I'm not going to lie to you, besides the regular cardiopulmonary issues that may be associated with it. So I'm curious for you, what sparked your interest in ear, nose, and throat disorders?
I mean, it's funny you mentioned that. Going into medical school, for me, I was kind of geared towards, I knew I like to work with my hands. So I was geared towards general surgery. I had done general surgery research, and, I did the general surgery rotation, and it was almost a done deal by my third year. I had a friend who told me, he said, well, you liked head and neck anatomy. You should try a 2-week rotation. At Brown, we had Tufts residents, ENT residents who would rotate down and kind of introduce us to ENT. And so I tried the 2-week rotation, and it just a combination of, head and neck surgery, allergy, things that I just, you wouldn't think, just in general surgery, we didn't have that kind of exposure. And the rest was history. I said, whatever it takes to get into ENT, that's what I was going to do. And so, I did away rotations. I was kind of on the last minute side, but, I was so passionate about it, and rightfully so, because, I haven't looked back since, and I'm glad I made the decision that I did.
Great. That's great. Again, I'm just proud of you and excited for the work that you're doing. And as someone who also suffers from seasonal allergies, I have a question about masks. Now, I know masks are like the big thing, and they've been the big thing for the last 2 years about should we wear them? Are they helpful against COVID-19, et cetera? But in terms of protecting us or protecting me from seasonal allergies, I found that wearing masks was helpful for me because I was not exposed to all of the pollen that were in the atmosphere. But now that masks are being taken off, are there any tips that you can share as we are in the springtime season, right? And we're going through the blooms that are happening in various places. What are some tips you can share with those who are suffering from seasonal allergies as masks are coming off and we're getting more into the open air environment at this time?
So, it's an interesting point that you bring up. Masks have been good. I mean, if you think about from an infection standpoint, from an ENT standpoint, it's always tough for us because we're conflicted. The masks were great, to prevent infection, but at the same time, when you think about kids and even adults, we get exposed to pathogens all the time, and that helps the body kind of get used to them. And so when you're wearing masks, sometimes you're kind of delaying your body's ability to process those, whether it be viruses or, pathogens that you get exposed to. So I find now, I mean, we had a period where we weren't seeing as many people who were sick in the past 2 years. And now all of a sudden there's an uptick because some of these kids just haven't been exposed to it. Same thing applies with allergies. Allergies, the more you get exposed to allergens over time, your body does get desensitized to it. And, they say this is a bad spring allergy season. Part of it, yes, it's because of the masks, because the masks were kind of blocking your exposure. What's interesting is we usually start with antihistamines, something like a Zyrtec or a Zysol, something that's not sedating, to try to block the antihistamine, block that histamine response. We also will sometimes add Flonase to help kind of temper the allergic response. Now, the next step is usually I'll have patients get allergy tested to find out what they're allergic to. But sometimes when they're very, very severe, we end up going the route of allergy immunotherapy, which kind of goes back to my original point. What we're doing with allergy immunotherapy, whether it's shots or drops, is giving you what you're allergic to in very, very small doses and kind of desensitizing you over time. Now with masks, it's the opposite. You're using what we call avoidance, which is good if you have one particular allergen. I think a good example, for me is I have a minor allergy to grasses. So when I'm mowing the lawn in the beginning of the spring, I'll notice some symptoms, but by the end of summer, I no longer react to it. So I kind of slowly desensitize myself. Another option is that people wear masks while they're mowing the lawn. It's better for those who have severe allergies because you don't want to take the risk of, even just a little bit of an exposure. Now, that being said, so just my approach is typically, avoidance first, if you can. And if avoidance works, then the medications that I had mentioned, can kind of keep you tempered. Now, if none of these options work, that's when you should consider getting allergy tested. I'm also, as an ENT, I'm also board certified in allergy. So we do a lot of allergy testing for those who really just can't get their allergies under control. I think it's important to know because sometimes you think you have one type of allergy and you realize it's multiple allergens. And so you just have been focusing your efforts on one, whether it be dust, or grasses or trees, and it's a combination. And so based on that, we can come up with, as ENTs or allergists, an idea of, how to approach that, whether it be immunotherapy, medicine, or a combination of the two.
That's interesting. Yeah, and I've actually benefited from Zyrtec and Flonase pathways. Very, very helpful, clearly. And I appreciate your take on the masks. I'm curious now. You talked about seasonal allergies and how that is affected by masks, but as an ENT specialist, you guys have played such an intense role and an integral role in terms of the pandemic and wearing masks in schools or not in schools, outdoors, indoors, restaurants, etc. And showing and researching how those masks have affected our pathways for breathing. But now as states are relaxing their mandates, and although it's somewhat truncated in terms of some states doing it and some states not doing it, most are going towards the realm or the pathway of taking masks out of regular rotation. What's your take, whether personally or as a professional, in this realm about us wearing masks at this point in the pandemic or at the end of the pandemic, or continuing to wear them regardless? I know a lot of gyms have stopped, a lot of healthcare facilities such as mine and other hospitals are continuing to do so. Restaurants have stopped, but other businesses have continued. So it's somewhat conflicting, but I do understand clearly the plus and minuses for both, based on what you just talked about and based on what's happening in our community. So what's your take on that?
So it is very, very tough. I'll tell you right now, we follow the science. And I think that's very important. Dr. Fauci obviously has gotten a lot of press throughout this process. And, I think what's important is knowing kind of where the levels are. If you live in an area where, there are increasing counts and, just like back in November and December, where almost, all counties and all states in the US were starting to battle with Omicron, that's definitely a time where the masks should be out. What I like now is we're kind of moving to a phase where when the numbers are lower and we seem to have it under control, then we put the masks to the side, but we don't put them away. I think that message needs to be harped, is that, sometimes when you take the masks off and then you end up bringing them back, people are bitter because they feel like, oh, you're taking something away that you had just given me. And I think Dr. Fauci has really been trying to harp on that, how important it is to put them off to the side. But remember, if the numbers go back up, we have to bring those masks back, because it's not only about you, it's about your neighbor as well. And when the numbers get very, very high, us as medical professionals, especially me in the hospital setting as an ENT, I see it. I see what happens and how overwhelmed the hospitals can get when the numbers are very, very high, and it affects multiple systems. And so I think sometimes it's hard when you're not seeing that and you're just seeing kind of what's happening in your community, but you don't see what happens in the hospital setting. So I think when, like now, where the hospitals are not overwhelmed, there are not too many COVID patients in the hospitals, this is a good time to keep the masks off to the side, because there are benefits. I mean, you talk about children and younger children, having the masks on and not really being able to read facial expressions and things like that. I think that it definitely does do a disservice to them. We just have to be cautious in terms of how we approach it. I am totally all about following the science, and I'm definitely not an expert into when is an appropriate time to take away the masks and when to bring them back. But like I said, Dr. Fauci, I follow him closely, and I think that us as a medical community, we hold him in high regard.
Yeah, I appreciate you saying that. I think a lot of people get caught up, like you said, that feeling of taking things away. And I sometimes feel like a bouncer at my clinic when I'm constantly reminding people, hey, you gotta put your mask up, you gotta bring your mask. And people, especially in New York City, as soon as that mandate was dropped, people were like, oh, we're good. And people were walking around without masks on, which is fine. But places that are still requiring masks, for them to come in and they don't come in, oh, I forgot it, I don't have it. They just stopped. I mean, we went from a place where everybody had a mask in their cars, in their pockets, in their bags, to I can't find a mask at all. And I do think, like you said, having that mask close by and just remembering that we have to continue to watch the trends is the best way to really look at it. I think a lot of people do feel, like you said, that we're taking things away from them and that they don't see any growth in that. But like you said, we have to trust the science and just see how the rates are going and the trends are going, because that's when we decide what is best for us. The same way we do with anything else that's happening. When it's going to rain, you bring a raincoat, right? When it's not going to rain, you may pack it, but you're not going to wear that coat. So it's the same concept as that. And I think if people continue, like you said, to look at it from that perspective, it won't seem like it's so binding for them or restricting for them to have to wear these things every now and then. We do it based on what's happening around us. So I
Exactly. I think it's become so polarizing, and that's the one thing I'm hoping going forward. It doesn't have to be a polarizing thing to wear a mask or to get a vaccine. We're all just trying to do the best for each other. And like you mentioned, in the healthcare setting, I still have to wear a mask. You're wearing a mask as well. But I think it's tough for those who are not wearing masks anywhere else, and then they come to our setting, and it's like, oh, why am I wearing a mask? And it's because, if people are sick, they're coming to us. So there's a chance that you might have, COVID patients and whatnot in a medical facility. So we can't take the chances yet until we really, really have this under control. And, it's all stepwise. The hope is that, in the next year or next 2 years, that we'll really have this thing under control.
Exactly. Doc, a lot of people are talking about this concept of COVID brain. I know it's a real thing, and some are talking about the lasting effects of COVID-19 on the body. Based on your studies, your research, your expertise, do you see any long-term effects of COVID-19 on our nasal pathways? And if so, what could be some of those things?
Yeah, so it's interesting that you mentioned COVID brain. That same kind of attack on our neural pathways affect sense of smell. And that's been, it's something that I used to see maybe, once every couple of months, whether it be from trauma, someone would have a cold and they would lose their sense of smell. Now there's been a huge uptick in those who have what we call, anosmia, or, they might have an altered sense of smell after COVID-19. And, you look at the statistics and these are all kind of dynamic because we're learning as we go. And, whether it be Delta or Omicron, they have different rates of affecting the sense of smell. But one of the latest statistics that I looked at showed about 12% of patients who have COVID and lose their sense of smell, that it persists long term. Now, what does that mean? I mean, we're not even at the 3-year point. We don't know if that 12% will continue to have the altered sense of smell or complete loss of sense of smell. But it has definitely been something as ENTs that we've been trying to work on because it is a complex issue. It's not something, we do have steroids that we typically will give a patient to try to calm down inflammation. But we find that it's not usually successful because we don't get to them early enough. when you're dealing with COVID, you're in quarantine and you've got other things that you're worrying about. So by the time they usually come to a professional like me, they're a couple months out. And that's kind of outside of the window where steroids are most effective. And so typically what will happen is I will send them to, I usually will gauge them or send them to a website that will direct them to a smell center to try to do olfactory training and retraining to strengthen their sense of smell. And sometimes that works. We're still coming up with data to find out what the long-term implications of it will be. But it definitely is a hot topic in ENT is now, loss of sense of smell and, COVID based. And how is that different from colds in the past where you would lose your sense of smell is very, very rare. Now, with this high prevalence of loss of sense of smell, our approach might have to change in terms of long-term management of it.
That's a big deal. Now, we've talked a number of MDs about the lasting effects of various issues, whether it's COVID-19 or other things. But when it comes to ENT, I think it's special because ENT life is a whole separate thing, right? We talk about ear, nose, and throat, and there are various ways to maintain a healthy life for our ears, our nose, and our throat. I'm curious, Dr. Voigt, in terms of diet, exercise, sleeping, how do these things, either positively or negatively, how can they affect us having a healthier ear, nose, and throat system?
So, you mentioned, weight and wellness is a shift that my office has kind of gone to. I have a BMI chart that's right on the door because of sleep apnea. Sleep apnea is something I deal with, whether it be surgically or through management using a device called a CPAP at night. But, losing weight and, being healthy sometimes alone can, rid patients of sleep apnea and, allows them to avoid surgery and allows them to avoid the, we call it the dreaded CPAP, even though these are long-term life-saving measures. Weight and wellness is key. And, a lot of times we see that people fall in their 30s and 40s, you have kids, you have stressors, and you fall into that trap and it happens. And, we end up getting to a point where we need help. And my office had realized, wait a second, we're doing surgeries, we're prescribing CPAP, but, getting to the root of the cause. Sometimes you need someone who can motivate you and get you on that path. And it's harder for some than others, but sometimes you really need that coach or that individual that can motivate you and get you back to a place where you can now start working on your own independently and maintain it, similar to what you've been doing, with Be More Today. A lot of it is, you lose that confidence and it's hard to get kind of back on track. And so, when it comes to sleep apnea, that's been kind of a major, emphasis and kind of focus of our practice.
We talk a little more about sleep apnea. I think a lot of people, even people that I know, have been on the baseline or on the line between someone who's snoring, has a snoring issue, whether it's allergies or what have you, or just improper alignment as they're sleeping, and then someone who may be a candidate for the sleep apnea contingent. How do you differentiate someone who may be a sleep apnea candidate or patient versus someone who just snores on their own? And is there a difference between the two? Is there a way to differentiate, one from the other? What are your thoughts on that?
Yeah, I mean, people ask me that all the time. What's tough is they come to me for snoring and I have to determine, could it be a septal deviation or more of a, like you said, allergy or nasal, component, or is there something going on in the throat? Now, if it's all nasal, you can mouth breathe, so you can bypass that and you don't have sleep apnea. Sleep apnea is when you can't get airflow at all through either the nasal and oral passageways, and it's usually at the throat level at night. And when you collapse and you stop breathing for a period of 10 seconds and then have to kind of reset, that's what we call an apneic pause. So where you're pausing and breathing. And depending on how many times that happens, you get a certain score. And so we can grade it in terms of mild, moderate, and severe sleep apnea. And a sleep study is how we're able to determine that. Sometimes I evaluate a patient, I look in their nose, and it's pretty obvious they have a septal deviation. I correct that surgically, and their snoring goes away. Those are the patients I don't necessarily have to take that extra step and get a sleep study on. But for a lot of patients where I'm not sure, I take a look and they potentially have big tonsils, redundant or longer soft palate, or, just their clinical history is suspicious for sleep apnea. I do get a sleep study. And that's kind of where that decision-making process of, where do we go from there starts. And the gold standard is the CPAP. I usually don't jump to surgery. A lot of times I will start with the CPAP with those patients and a discussion on weight loss if that applies. And then after 6 months, if they feel like the CPAP, it's hard for them to tolerate the CPAP, or they would like to discuss surgical options, that's kind of when they come to me and discuss that.
Did you see an increase or a decrease in terms of number of patients that you were seeing when it comes to ENT issues, when people were doing more things outdoors versus indoors? Just curious. I know a number of people were doing like outdoor exercising and running, etc., during COVID because gyms were closed and whatnot, and people felt like things like running and outdoor activities were more feasible because you couldn't do things indoors. But I was curious if there was any kind of either decrease in the number of people you were seeing based on pathologies when people were doing more things outside, or was there no real change in terms of the numbers you were seeing?
So it depended. I feel like there was a decrease because people weren't coming to the doctor's office during COVID, when we were at the height of COVID, for fear of, sometimes fear of infection, sometimes they felt like they wanted to prioritize things, say, that they felt were more pressing. And now all of a sudden we are seeing that there's a huge uptick in patients who have been putting off, whether it be like how I mentioned, weight gain during the pandemic, and now all of a sudden it's leading to health implications such as sleep apnea. And so we're seeing an uptick in patients coming in for things like that. Now, I do also deal with a lot of cancer patients, and my hope, throughout COVID, we were trying to bring as many of those patients in as possible, but same thing, some of them did delay. And so we are seeing some patients who have a lot more pathology than they would have had they come in sooner. So, it's been a difficult situation for all of us. I know at one point, during COVID, we were, partially shut down. We were seeing patients about 1 or 2 days a week, and really just trying to harp on those who had urgent issues. But it's really hard for a patient to know themselves what's urgent, what's not. We would say, things like earwax, we would try to put off, but eventually, sometimes if the earwax builds up, they can have ear infections or have other pathologies. So it was very difficult, I think, for us as in the outpatient medical community, but also I deal with a lot of inpatient pathology as well. So you were seeing the struggles on both sides. That being said, now we are definitely back to a level where I am seeing a lot of patients I hadn't seen in 2 or 3 years. And, the majority, I think, we're able to kind of push through, but occasionally you see those where, the effects of COVID were there. So, yeah, I don't know if I fully answered your question, but no, yeah, I definitely felt like this time period was altered because of COVID.
Yeah, no, you definitely answered my question. We had the same thing. We saw a number of declines in terms of our numbers based on COVID, but we did see that, whether people were coming or not, they were still coming back with issues and ailments and surgeries, and people get hurt regardless, whether there's a pandemic or not. So I think that was just a constant for us. I'm also a running coach for a local Brooklyn community, and we talk a lot about diaphragmatic breathing. And I was curious if, in terms of your study with ENT work for the last number of years, if you can just kind of, if you don't mind, just kind of give the listeners a general overview of what that even means, because breathing is something that we we do all the time. I think it's something that we sometimes forget to do when we get stressed out or we get busy, and then maybe we kind of alter our breathing techniques as we are going throughout our workday. But there is a proper way in terms of how to breathe when it comes to breathing from your diaphragm. And I was curious if you wouldn't mind expounding on that a little bit during this podcast for a second.
Yeah, so I honestly wouldn't be the expert on the proper mechanics of diaphragmatic breathing. I can tell you how it affects your voice. We have patients who will have strokes and things like that, and their breathing mechanism is altered, and that will then affect their airway and breathing passages, because we always say the lungs are the motor. And that motor will allow the vocal cords to then alter, our voicing, our, crying, so the way that we are able to make sounds. And so, as far as, the proper way of, breathing and things like that, I wouldn't be the expert and the one to talk to, but I can tell you that it does affect things upstream. And that's usually what I deal with is, I usually will work in conjunction with either pulmonary or sometimes rehab to try to get them to breathe more efficiently and get more air so that they can vocalize better.
Yeah. I was talking about it just because we have a number of people who, as a result of the pandemic, have been doing more running outdoors, and we always talk about just ways to make sure that our diaphragm is actually moving properly. And difference between chest breathing and belly breathing when it comes to us going out there and actually using our bodies to do certain activities, like exercise and running and what have you. But I do think, like you said, a number of those things can become more beneficial if you're breathing properly from your diaphragm and using that force, like you said, from those lungs to propel yourself forward. I recognize that as we continue to wear masks, that people have kind of adjusted to their ability to breathe properly with these things on. And when we first started wearing masks, people said, "Oh, I can't do this. It's going to be too hard for me to wear this. How can I get through this?" And then you recognize that people like you and other doctors and nurses and surgeons wear masks for hours at a time. I've been doing this for years on end. So, I just want to remind everybody that it's not a new thing for us to be in this situation. We're just now being exposed to something that a number of people have been doing for a long number of years, if not decades, wearing masks for work and for play and what have you. So it's something that I think that, like you said, we'll have to just get used to and be able to do either on and off as we see so fit.
Yeah, I mean, I think it's fascinating our ability, to adapt. I when I go to my clinic, I make it a point. I go up the stairs, and so it's about 4.5 flights of steps, and you add the mask to it. That definitely adds a challenge. And then you add, at one point, us being ENT, we're wearing N95 masks. So I would start wearing the N95 and going up that those flights of steps. And in the beginning, it's a challenge. You get up there and you feel like you're not getting as much airflow, but then you get to a certain point. And I think for me, it was probably a week or so in, you forget that you were struggling initially wearing that mask. And I think that's what happens with us is that, we weren't wearing N95s before the pandemic, but we were wearing regular masks and we were wearing them, all day. I wear them, when I'm operating, and you don't think about it. And so I think that there's always an adjustment for anyone when you're wearing the mask. Even now, I don't wear the N95 mask as much as I used to. So those days when I do have to wear the N95 mask, there's that adjustment. But you get used to it. And, I think the greater message is for the greater good. We're trying to, help our neighbors and help ourselves. So it's worth it.
Yep. Back to perseverance, like you said, absolutely. So, Dr. Voigt, any final tips you want to share with listeners about anything related to ENT life, ENT health and wellness, or any tips you want to share that is related to anything you talk about today?
No. I mean, I think sleep apnea was one that, I wanted to harp on just because, like we talked about, not many people know about sleep apnea. Not many people know that they have it. But, the long-term benefits of CPAP therapy are immeasurable. I mean, we've noticed that patients who have sleep apnea and, it goes unchecked, they're at increased risk of heart disease, of stroke, high blood pressure, things like that. So you're seeing ENT is now into sleep, cardiology is into sleep. It used to be more pulmonary, and you're seeing many specialties, even oral surgery and dentistry, because we realize the benefits and the long-term health implications of sleep apnea. So, those who are listening and, they, have themselves or significant other who they notice are snoring and snoring to the point of potentially stopping breathing, it's important that they come in and they get themselves checked. I think that's my One Health plug that can really change someone's life.
Absolutely. I appreciate you sharing that with me, and I think that those who are listening will take that to heart as well. I think that sleep apnea is definitely something that we should all be a little more cognizant of. And, like Dr. Voigt said, just going out there and looking at the research, looking at these studies. If you find that there's someone in your area, someone or someone who's in your household that is showing any of those signs and symptoms, then like you said, please go out there and see someone about that ASAP. And Dr. Voigt, thank you so much for being on this show. I really appreciate your expertise and your knowledge.
Inviting me.
Just so happy to, again, just have you as part of our Be More Today community. Where can people look for you on social media or otherwise?
So for me, I'll be very honest. I haven't been as up to date on my social media. That is a push for this summer for me and my company. But I do have a website, entdoctor.com. We try to make it pretty simple, and it's entdr.com. And we also have a Facebook presence, Associates in Otolaryngology. I look at how, successful you have been in terms of your social media presence. And, that's something I look to aspire to. But yeah, those are my two outlets, and, definitely look me up. I just want to, this is kind of a little bit of personal plug here. It's happy birthday to my brother, Cliff. It's April 5th. So I'll be talking to you later.
That's right, Dr. Voigt. Happy birthday to him. Aries all day, we already know. And just happy to have you on the show today. And I kind of want to just give a closing plug. And this is somewhat separate from the ENT conversation, but Stanley, you and your brother and your sister, it's kind of crazy. The three of you guys are all doctors, and the fact that from one household came three MDs in my generation is incredible. I just kind of, if you don't mind, we're talking about perseverance still, and it's kind of off the subject of the ENT conversation. But Be More Today is not just about us looking at the accomplishments, but also looking at the journey. And I'm just curious, in the last couple of minutes of this show, if you would just share, what it feels like being part of a family of immigrants, right, who came here and were able to not just produce one MD from a family, but three MDs. What that experience was like for you, and what kind of motivated you and your sister and your brother and even your parents, I think, to continue to be so great and continue to be so influential in this field of a profession, the medical profession.
I mean, it's funny that you mentioned that. It really does go back to the parents. And, what's interesting, me now being, a parent and having three children, I start realizing some of the things, and I have some, more in-depth conversations with my parents about what they did with us. And, we were always involved in activities. I think sometimes keeping us into activities really kept us from some of the other things that we could have done. And, we talk about dance, we were dancing, I was doing tap and jazz and, at one point ballroom, I played the violin, they got us into piano, and you don't realize the trips, my mother had to, there's a lot of back and forth, that she had to really sacrifice her time and energy. And then also conversations, the conversations I'd have one-to-one, with my dad or my brother and I being by his side. And, sometimes you don't realize the effort and the energy that it takes to be a parent and to be there and to be present And sometimes they don't appreciate it too. And I can tell you that, there were times where my brother and I may not have appreciated it. And now we look back and say, wow, some of those things that, he told us or he taught us were profound. And the time that my mother put into us, it really is a testament to their hard work. And so I try to, I talk to you about social media presence and things like that. Sometimes I feel like I sacrifice my ability to be on social media because I want to put more time into the kids. And it's hard because sometimes you'll post something and you won't be on social media for another 3-4 days. And people are like, wait, where did he go? And so that's kind of why lately I've kind of drifted away, because I want to be able to, focus on my kids. And sometimes with work and kids and things like that, it really does add up. But I use them. I mean, they've been my role models, and both my all three of us, my sister, my brother, and I, whenever we have conversations, we look back on what they have done and had done and continue to do. And I think hard work, it's a team effort. It's not just the individual. You need support. There's going to be lows and there's going to be highs. And, I had a lot of support throughout my lows, and then we had praise throughout our highs. So, I think it's always, it's always a team effort, and it doesn't always have to be the parents. Sometimes it's the siblings, and sometimes it's people in your community coming together to help you. But I think that kind of is what contributed to the three of us being able to get to where we got to.
Love it. I love it. Just share with them what professions your sister and brother in, and your parents.
Yeah. So my mother's a housewife. She did go to beauty school and she's a hairdresser. But she spent most of her time, with us at home. And my dad is a psychiatrist. My little sister is also a psychiatrist. And then my brother is an orthopedic surgeon.
Again, just really impressed by you guys. And, as a family who is of Haitian descent, it's just beautiful to see the progression, to see you guys thriving. And I feel like I'm a part of your family, so I'm proud of us. So
I appreciate, like I said, your mentorship, just, being able to see people who, look like you and are able to do, what we have been able to do. You don't realize how profound that impact is on those downstream. And so, I know you mentioned, I think you were a senior when I was a freshman. But the year before, even as in high school, I came up, and I think you and Cliff had a fusion dance performance that you had at Harvard. And I took it as an opportunity. Okay, I could see Brown and then I can go up to Harvard. And just the way you carried yourself, it was, and the whole group, the fusion group, to me, I was like, wow, and it really inspired me to go to Brown. And then just beyond, when I got to Brown, the dances that you included me on, and just looking at, how you really emphasize the details and the techniques. And so sometimes, when whether it be surgery or whether it be working with the kids, it's a lot of times it's about detail, it's about perseverance and not giving up. And some of those skills that you taught me, or that you continue to encourage in us, I now try to give that downstream. So I think it's important that you've had such a profound impact. Cliff and I talk about you all the time. So keep on motivating, keep on doing what you're doing, and I'll try to do the same on my end.
Oh man, I appreciate that so much. You have no idea, Dr. Voigt. That means the world to me. So thank you so much. And again, this has been a great episode. I appreciate your time, your effort. I know you're on spring break. It's time for family. And I gotta give you kudos on the family tip. I know I'm on social media a lot, but I do think that it's all good to sometimes just say, what, social media, I'll see you in 3 days. It's family time. So no shame in that game. Keep doing what you're doing. Continue to inspire your community. And thank you so much for being on episode 92 of this show. I appreciate you so much.
You're welcome. You're welcome. It's been a pleasure.
Yes, sir. And folks, don't forget the quote from today by Judge Katani Brown Jackson. I would tell them to persevere. Dr. Voigt said it simply. He's been through so much. He's had a legacy of people before him show him the way. He includes me in that legacy, and I appreciate that. But it's really about persevering. And you heard his story. You heard his his tidbits and his help tips for everyone to go out there and just continue to keep their ENT life well, right? Your diet, your exercise, your sleep. For those of you who are trying just to be better in terms of those things, and you are curious if you fall into that category of sleep apnea, go see somebody ASAP. It can lead to so many other things down the line. And like you said, let's continue to mask up or just keep them close to you as needed until we are all the way in the clear with this pandemic. Thank you so much for being on the show. As always, watch us on BeMoreToday.com for my book, our swag store, the podcast, everything Be More Today related. And any questions from me, Dr. Voigt, email me directly at BeMoreToday, Dr. Sean at BeMoreToday.com, or send us a message on Instagram, Facebook, Twitter. We're on everything Be More Today PT. We're out there. Follow us, subscribe. We love you guys so much. As I always say, have a good day, have a good night, have a great life, and continue to take your steps of greatness to be the best version of you. We'll see you next week. Peace.